If you're taking tamoxifen or you're about to start it, this video covers everything you need to know. I'll tell you how it works, who should be taking it, and what the side effects are. And as a special bonus at the end, I'll tell you whether it's safe to take supplements at the same time. I'm Dr. Liz O'Riordan. I'm a breast surgeon who's had breast cancer 3 times, and I do the research so you don't have to. Make sure you hit the subscribe button so you don't miss next week's video. Tamoxifen is only used to treat breast cancers that have estrogen receptors or ER+ cancers. Now, estrogen is a female sex hormone that's absorbed in places like the brain, your bones, your skin and your breasts, and it does this through estrogen receptors on the surface of cells. 70% of breast cancers overexpress the estrogen receptor. That means when estrogen attaches to those receptors, the cancer cells are stimulated to grow and divide. So how does tamoxifen work? It's a type of drug called a selective estrogen receptor modulator, or SERM. Gosh, that's a mouthful. It has 2 actions depending on where it's absorbed. In your bones, it boosts the estrogen receptors, and this can help prevent osteoporosis in postmenopausal women. But in breast tissue, it does the reverse, and it stops estrogen receptors attaching to estrogen, and this means that the breast cancer cells aren't stimulated to grow. And because your breast cells aren't absorbing estrogen anymore, your blood level drops, and that's why tamoxifen causes side effects. So who gets tamoxifen? It's only given to patients with an ER+ invasive breast cancer. If your cancer is ER negative or triple negative, there are no estrogen receptors. Tamoxifen can also reduce the risk of recurrence in the future by up to 50%. The effect it has on your own risk of getting metastatic disease in the future depends on the size and grade of your cancer and whether your lymph nodes are involved. Tamoxifen will also reduce your risk of getting a cancer in your other healthy breast by up to 50%. For men and premenopausal women, tamoxifen is the only hormone blocker you can take. And this is because the other option, an aromatase inhibitor like letrozole, only works if you're postmenopausal and your ovaries have stopped working. If you're premenopausal with a high risk of recurrence, your medical team may want to switch off your ovaries with an injection called Zoladex, as this further reduces the risk of you getting a recurrence in the future. And I'll be doing a video on Zoladex shortly, so remember to subscribe. Most postmenopausal women are started on an aromatase inhibitor, but if you have a low risk of recurrence in the future, you could be offered tamoxifen instead. And it's also given to some women with a very strong family history of breast cancer, and this is chemo prevention to try and stop them getting breast cancer in the future. Your doctor works out your risk of recurrence using a computer program such as NHS Predict in the UK or Adjuvant Online in the US. And these algorithms compare your breast cancer with thousands of women with a similar tumour to tell you what the benefits of hormonal treatment are. I'll be recording a video on that shortly. Now, in the UK, we don't give tamoxifen to women and men with DCIS, although this is sometimes done in the States. And finally, if you have metastatic ER+ breast cancer that's spread to your organs or your bones, for example, you may be given tamoxifen as part of your hormone therapy. This will depend on the treatments you've already had for your primary cancer. So how do you take tamoxifen? Well, it's a small tablet that you take at the same time every day. Some people prefer to take it in the morning. I prefer to take mine at night, hoping I'd be asleep when most of the side effects kick in. If you have trouble swallowing tablets, it is the only hormone blocker that also comes as a liquid, which can be really helpful if you've got an elderly relative who has trouble swallowing. Now, this is important. Tamoxifen causes birth defects, so you must use birth control if you're taking it. If you want to get pregnant after a breast cancer diagnosis, we normally advise taking tamoxifen for 2 years and then waiting for a couple of months so the drug gets out of your bloodstream before stopping your contraception. Can you take other drugs with tamoxifen? So tamoxifen is broken down in the body by a group of enzymes called the CYP450 system. And what they do is help the body metabolize a lot of other drugs. So if you take tamoxifen at the same time, it can cause serious problems. Your doctor will check what medication you're taking before they start you on it. There are some drugs that can interfere with the way tamoxifen works, such as warfarin, the blood thinner, and antidepressants like Prozac and Seroxat. And if you're taking those drugs, your team will put you on a different hormone blocker. Now this is interesting. Grapefruit can also interfere with how tamoxifen works. It is safe to eat or drink the juice, but you shouldn't have it regularly. Every once in a while is okay. How long do you take tamoxifen for? If you've got a low risk of recurrence, you'll be on it for 5 years. And if you have a medium or high risk of recurrence, you'll take it for 10 years. And that means generally people with positive lymph nodes, large cancers and a higher grade. And I explain what tumour grade is in this video. As a rough rule, if you've had chemotherapy, then you'll almost certainly take tamoxifen for the full 10 years. But new trial data is appearing all the time, so this might change in the future. And at your 5-year follow-up, your doctor may discuss whether you need tamoxifen for another 5 years or whether you can stop it. What are the side effects? Now, I scared myself silly looking at blogs to see how bad it could be. And as a breast surgeon, I used to tell women that they might have 6 months of hot flushes and a bit of vaginal dryness. I was clueless. And I was now about to take tamoxifen myself, and I wanted to see how bad it could be. The side effects can be bad, I'm not going to lie. They can make your life miserable. But a lot of women don't struggle, and the symptoms do generally settle down after the first couple of years. And there are also lots of things you can do, such as complementary therapies and more standard drugs that can help with them all. And I'll be telling you how to cope in my next video, so make sure you subscribe so you don't miss out. You can also talk to your doctor about having a treatment break for a couple of months if you've got an important event coming up, trying a different brand of the drug, even taking half the dose, called baby tam, or possibly stopping it altogether if you've been on it for a few years and you've got a low risk of recurrence. Why do you get these side effects? Well, as I said earlier, tamoxifen stops your breasts absorbing oestrogen, so your oestrogen levels drop in your bloodstream, effectively making you menopausal. The common side effects are hot flashes, night sweats, tiredness, dry skin, hair thinning, vaginal dryness, loss of libido, water retention, nausea, mood changes and headaches, all completely delightful. You may find your periods get lighter or stop altogether, but there are 3 serious side effects that you do need to know about. The first is that tamoxifen increases the stickiness of your blood. This means you have a greater risk of getting a blood clot in your leg, called a DVT, that can travel up to your lung and cause a pulmonary embolism or a stroke. If you've had a blood clot in the past, then you won't be given tamoxifen. Secondly, tamoxifen can cause cataracts, so if you wear glasses, you should have your eyes tested every year. And finally, it can cause cancer of the womb or endometrial cancer. So if you have unusual vaginal bleeding or spotting, then you need to tell your GP so they can refer you to a gynecologist to get it checked out. Here's the bonus section. Can you take supplements with tamoxifen? I get asked this so much, and I'll be honest, I haven't heard of half of the supplements people message me about. I was amazed at just how many are out there. Some of you are asking about pills and potions that could cure your cancer or stop it coming back. Others ask about supplements to help with your skin or anti-aging or cosmetics. It's just a whole myriad of stuff out there, things that might help with the hot flushes. Because tamoxifen is metabolised by that important group of enzymes, there is a chance that an over-the-counter supplement could interfere with how tamoxifen works and stop it being effective. And your doctor is unlikely to know whether a supplement is safe or not. It's hard enough for us to remember the interactions of all the normal drugs we prescribe, let alone everything out there that you can buy online. The hard truth is, it's up to you to decide whether you think it's worth the risk. I've looked at a few websites selling supplements, and almost all of them have a legal disclaimer in the small print at the bottom. They cannot guarantee that it will work. They cannot guarantee that they are safe to take. They tell you to check with your doctor first, just in case. And as I've said, most doctors don't know. It's a get out of jail free card for the company. It's really, really hard for us to know what's the truth to tell you. There is some data to suggest that turmeric, curcumin, ginseng and St. John's wort can make tamoxifen less effective, and the guidelines tell you to avoid those. There is one website I would recommend you use to check, and it's the Memorial Sloan Kettering Cancer Centre website about herbs, botanicals and other products, and I'll put the link in the description. This does have information on almost every supplement out there, but you need to read the information for patients and for doctors to get the full picture. I want you to remember, though, that as far as curing cancer goes, there is no magic bullet. If you don't have any other medical problems and you eat a healthy, well-balanced diet, you should be getting all the vitamins and minerals you need from your diet. You'd be better off eating more fruit and veg than spending money on supplements and vitamin infusions. And that's what the World Health Organization recommends for cancer patients. In next week's video, I'll show you how to cope with all the side effects of tamoxifen, sharing the tips and tricks that I've learned. So make sure you hit the subscribe button so you don't miss out. I'm Dr. Liz O'Riordan, and thanks for watching my channel.